Looking for the best hair transplant advice? You have come to the right place, and in today's video, we are going to discuss a case of Norwood grade 3 male pattern baldness, and we will see how we planned this case and what were his results and how scientifically all these calculations were made. And before we jump into that, we will also talk in this video about our AI based app which predicts the kind of results you will get after the hair transplant. I am Dr. Satya Saraswat, a gold medalist plastic and cosmetic surgeon working in the field of hair transplant since 2006. This 25-year-old male patient came to us with a long-standing history of 7 to 8 years of hair loss. He had taken minoxidil consistently, and probably that had prevented accelerated or fast hair loss in his case, and it had helped him regain many of his hairs. This was quite effective in his case, but when he came, the hair loss has progressed to Norwood grade 3, and this patient had receding hairlines and deepening of these frontotemporal angles. So when he came to us, as a rule, we do the trichoscopy. His density was quite good. It was around 80 follicular units per centimeter square. His average thickness of hairs was more than 0.08 millimeter, which is very good. His terminal to vellus ratio was again very good. More than 90% of his hairs were terminal. Also, we found out that his average number of hairs per graft were 2.1, which is also on the higher side. His coverage value was also very high. It was around 15. His donor site was more than 150 square centimeter, and he had more than 12,500 grafts available at his donor site. Then we marked a hairline in the bald area, and we found out that his total surface area including both the sides was around 45 centimeters square in his case, and we planned a density of around 40 follicular units per centimeter square. Please like the video and we will carry this video forward. In this picture on the screen, you can see the area which was covered after the hair transplant, and in this case we did 1825 follicular units, and on the screen again you can see the information regarding the 1 hair, 2 hair, 3 hair and 4 hair grafts which is available for you to see on the screen. If you are also planning a hair transplant for yourself or your friends or family members, you can call us at the numbers mentioned on the screen, or you can send your pictures of the bald area and the donor site at the back on the WhatsApp numbers given here, and we will try to respond to you at the earliest. Coming to the procedure, as is standard, we do a hairline designing where we take the feedback of our esteemed patients also, and then we do a sensitivity test, and after that we do the trimming of the donor site and if required for the recipient site as well, and then we give the local anesthesia. After giving the local anesthesia, we make the slits or the sites. We start extracting the grafts by FUE procedure. In this, each graft is individually taken out using a specialized hair transplant extraction machine. After the grafts have been extracted, they are sorted into 1, 2, 3, 4 hair grafts, and then the insertion is done by our technical team under our supervision. Patient was given a detailed instruction sheet in our post-op follow-up team. They were in touch with this patient. He regularly used to come for the checkups and the PRP therapies, and at 4 months we started that the hairs were coming out, and he's quite happy with the kind of results he's getting, and regularly is coming at couple of months interval, and every time we see that more and more hairs are coming out. And then he came at 1 year, and we did a wet combing for him, and we found out we had got a very good density and his hairline was very natural. And again he had come at 2 years follow-up, and we could again see that his results were fantastic, very natural looking, and his patients extremely happy with the kind of results he has got. He has overcome all his shyness and other problems for which he wanted to get this hair transplant done. Where there are 2 American board certified hair restoration surgeons, and where each case, each patient is given unique attention, customized planning is done for all the patient, and the concerns are also empathically heard by us, and then we go forward with the hair restoration, hair loss or medical treatment, whatever is required for that patient. Now I want to discuss about our AI app. This app is by the name of Saraswat Hospital, and it is available on both Apple iOS system and the Android Play Store, where you just have to download, fill up some basic information, and our AI based algorithm, after a unique feedback from our American board certified doctors, gives you or generates you the kind of results which can be expected. Before we just end up this video, I would like you to keep in mind 5 important points while selecting your hair transplant doctor. Number 1 is that the doctor should be ideally an American board certified hair restoration surgery. ABHRS is the highest certification authority in the world in the field of hair restoration surgery, and preferably a member of ISHRS also. Point number 2 is the transfer transparency with which the procedure is performed. The number of grafts should be displayed on the counter. There should be a transparent way for you to know how many grafts have been extracted or inserted in your case. Point number 3 is unique customized planning, which should be done in each and every case using the gadgets or the softwares like trichoscopy. Number 4 is that the team of this clinic where you're getting a hair transplant done should be permanent. They should not be on daily hiring basis, because this kind of team members are not dedicated to the patient welfare and not dedicated to your growth or whatever any problems if you are facing. And last but not the least, look out for the doctor who is active in the field of teaching other doctors also. And in our hospital, we have trained more than 90 doctors in the field of hair transplant from world over, and all of them are busy in their hair transplant practice, and we are training doctors since 2016. If you like the content of this video, we request you to share it with the friends or family members so that they can also take advantage of this planning and the results you have seen in this video. If you want to know the factors affecting the cost of hair transplant, please click the video on the left, and if you want to see one of our latest hair transplant results video, please click the video on the right.